risk of being accused of complaining. But I speak because I have a duty to the people of Northeastern St. Elizabeth, who elected me to be their voice and to be their compass. My issues today are multiple, but I will give you the abridged version. And I'll start with a long-standing practice which has really merged into a convention whereby ministers or officials of the government ought properly to notify a sitting member of parliament before entering that MP's constituency to do any government-related issue. Now, that is not just a matter of parliamentary etiquette or constituency etiquette. It has its rationale in ensuring that as the duly elected representative of the people, you can be informed as to what is taking place in your constituency, so that by extension you can inform the people, so that you can make yourself available when the government officials are present to continue to represent and advocate on behalf of your residents and your constituents on issues that concern them most, issues that you might not have an opportunity in the parliament to raise because of the rules of the parliament. In a time like this, a very sensitive time when the most vulnerable are most
Thank you,
at risk,
Abigail Campbell.
we expect that
Well
that
done.
practice will
Thank
ensure
you.
that there is
Back up the
collaboration
line.
between the government officials and the elected representatives to ensure that persons can benefit. In my constituency, I have had to sit and watch as persons approach me the day before a visit to ask me if I heard that the Minister of Local Government is coming into the constituency. What is it that they're coming to do? Where can they meet them? And I have no answer to the questions because I was not notified in advance. In my constituency, first the Speaker of the House came, and perhaps she came in her capacity as an individual outside of the politics, but by her utterances, she made statements to suggest that she had visited communities, and every community that she visited, the residents were not hopeful that they would get any assistance from me as the member of parliament. And I thought it was very unfortunate that in a time like this, we would seek to sow seeds of division and discord. Because the Speaker of the House visited 3 communities, all strongholds of the Jamaica Labour Party. Not one KP community was visited, not one KP community was given any of the care packages. In fact, the areas visited are well known: Rocky Hill, Santa Cruz, Burns Savannah, which is regarded by Edward Seagas, Little Tivoli. No reference was made to any other communities, but the Speaker formed the conclusion that every community she visited were not hopeful that they would get help to build back houses or do repairs. And I speak on that because she came into the community on Saturday morning, and by Saturday afternoon, the Minister of Local Government also visited the constituency. He distributed care packages, 60 to the City Jamaica Labour Party Council. But I was not informed of this visit prior. The 3 other councillors who happened to be PNP councillors were also not informed of the Minister of Local Government's visit. And of course, they got no packages from the Minister. Only the PNP council received packages.
No, this is so unfair, though. This is so unfair because this hurricane, Melissa thing, it don't visit one set of party alone. It doesn't visit the green and leave the orange. It visits everybody. So why, when they are sharing out, helping, they just helping one set of people? How could people be so selfish and heartless? Things like this happen. Everybody suffering. Everybody going through a rough time. And this is how they choose to handle it. You understand? They give a set, and she's not the only one I heard. I've listened to all of it, and she's not the only one I heard saying that. Even Westmoreland, they mostly visited the Liberate. Some of them mostly visited the Liberate area, and so we are everybody. The storm hit PMP, JLP, and no P. So whatever funding or relief benefits or anything, everybody should get it. Everybody should have a taste of it. Everybody is hungry. You understand? This is not a political PMP and JLP thing. This is for a humanitarian. Everybody needs help. So why some people make it so hard? Why they're so? Oh, I may tell you. Sometimes when you listen to them news, yeah, me no want to get riled up about it. Me no want to, you know, elaborate for it too much. Cause me can't bother. Because when me listen to them or something, it just make me get angry. When me say angry, real angry because it's unfair. You understand? This is Jamaica. We're Jamaicans. Put away the partisan thing now. The politics done long time. Work for the people of Jamaica. You know, if you pick and choose who to give or who to help or who not to help. It's not healthy. Let me make it continue to listen what she's saying.
And finally, the Minister of Justice came on Friday, and my constituency office happened to be right next door to the venue that he visited. I was not notified in advance. No, it doesn't matter. I see the statement from the minister, and labeling a statement as being contained or filled with lies or accusing you of lying does not make it untrue, and it does not change the facts. The facts remain, as I stated in my earlier video, that the minister came into the constituency without prior notice. The minister came into the constituency handing out or distributing supplies. It doesn't matter if it was civil or 77. The parliamentary practice, the convention still remains. It is improper to visit an MP's constituency without prior notice. That is a practice that has long been observed. And if it is that the government is now departing from that practice, then we need to know why. Because we're striving towards good governance. In England, they have codified that almost in a sense by having ministers' code to set that out. That ministers of government must notify and not just give just passing notice on the day, but proper notice. Perhaps it is time for us to implement that here in Jamaica. Secondly, I speak on the issue of housing because the speaker made mention that persons that she spoke within the communities, the JB communities that she visited, were not hopeful that they would get assistance. Like many of these members of parliament, I also received only $10 million as an allocation for housing repair. On the very first day that my constituency office reopened after the hurricane, we had over 600 persons in attendance at the office asking for housing assistance. Over 600. And when I went into communities like Mosquito Bottom in Windsor, they didn't even know that there was a deadline given by the government to report on matters such as those, but their information was never captured. I raise it to say to you that the government, you've heard, has given a directive that they are recommending that you give 100,000 to each beneficiary. I have not been able to do so. I have taken the decision that I cannot choose who should benefit and who should not. I cannot choose who should get help to put on back their roofs and who should not when everybody needs help to put on back their roofs.
Good.
And so every one of those 600 and odd persons who applied for housing assistance, I've submitted their names. And so it means that they're not going to get 100,000 each. It means that some of them are going to get $12,000, which is only probably
But
three
that
sheets
can't
of
do
zinc.
anything.
What do we do when the funding is
Because
not
they're gone
sufficient?
by one sheet of
And
it.
let me make it clear. I have PNP people who voted for me. I have JP people who voted for me. And I have people who never support the politics before I can go vote. So I don't care who people vote for. When I go into a community to distribute supplies or to assist people, I have never asked them who they voted for. Once I have it, I'm going to share it. Even though it means sometimes getting quarrels from your own supporters who feel as though you're helping the other side or that how you're helping them. And
Let me pause this a while. You know why I pause it a while? Some of these politicians must end up with gray hairs before time. I noticed some of them, that when they enter into politics, they're young and green and pretty, and when they leave, they're old and gray headed because the amount of stress where them have to go through, the amount of stress, appears stress. No, sir. I don't know how they manage being a member of parliament, I mean, prime minister or president or something. I remember even Barack Obama, when he was entering into politics, Barack Obama was young, fresh and green, black hair, everything. And when the man left, the man looked like them great grandfather. You know, so there's something stressing bad. And look at the poor lady now. She have to just it's like the lady who like Zulika look like she want to cry. Look like she want to cry on there for people because they're not being treated fairly. And I think it's really, really bad. So let me go back to it. You can.
I say this to say that we do not support the practice of division. We do not support the practice of undermining duly elected representatives whose only intent is to provide help for people who are suffering. We see people who are in need. We don't see JP, we don't see PNP. We see people who are vulnerable and who are dependent on the government to make the right decisions so that their lives can be better. And that's the only objective that we have over here on the People's National Party side. Now, finally, I speak to the issue of infrastructure. The constituency that I represent suffered not just physical loss to the houses, or road work was completely destroyed in areas, particularly in Santa Cruz, where it seems as if a bomb was dropped overnight. We have holes in the roadways which were over 20 feet deep. Now, I've tried my best to assist, but these are all temporary gaps, temporary stop gaps, by using the debris that have been washed away to try and fill back the holes so that people can't say that they are maroon. But what is the plan going forward? Because one more shower of rain and more than that wash away, and people again when they maroon. The people in Abraham who did not try to fix the road and did the best that we could. They tell me that when rain falls, they still have to walk to get home up in the hills because the cars still can't manage because it's more than dirt that was used. So it has slipped away and it's slipping away. What is the plan? Are we going to wait until something disastrous happens before we put in place plans and solutions that will actually endure to the benefit of people? In Santa Cruz, we have a situation where all of the mud, all of the debris from the hills washed down into the town of Santa Cruz. So it is not uncommon for you to see people wearing dust masks when you visit Santa Cruz. What is the plan? The government has started to clear the roadway in Santa Cruz without any notification to me as a member of parliament. And now we are left with a situation where I don't know if there is funding that is left, but the road needs a water truck to actually wash away all of that mud, all of that debris. What is the plan for Santa Cruz? What is the plan for the areas in Thornton? Thornton has over 1,500, almost 2,000 persons, and 95% of Thornton lost roofs. Some houses have completely.
So sorry about that. Let me continue on what
Have completely crumbled. What is the plan? Because my $10 million done, and I still don't know how we're going to help the rest of the residents in Windsor and the other areas, even in Brace River, that got flooded out and who go around and pick up 2 sheets of zinc and nail it on or tack it back on. But then those are the next shower of rain, they're going to wait up again and they're going to strong us up wind, they're going to blow up again. What is the plan? I close by saying that I have absolutely no intention to be a contact person. If I am to be somewhat passionate, forgive me. But when you represent people who see you as their only hope, who come referring to. We have a duty to speak on their behalf, and we have a duty to hope that the government listens and the government acts. Thank you, Member Parliament. It will appear.
No, she have spoken her piece. She's angry, and I would be too. She's angry, and I would be too. I'm going to finish reading the article on um, third. Jess brought attention to the severe inadequacy of the central government's financial relief package, while the government allocated a flat amount per constituency, example $10 million, under the support program for post Melissa rebuilding. She said in her constituency alone, over 600 persons sought housing assistance on the first day of office. Oh yeah, she just said it a while ago. All right, on the first day of um on the first of office reopened. She explained that with limited funds, benefits are often negligible. In some cases, only enough to buy 3 seats of zinc. You see? Finally, she stressed that the relief distribution needs to be equitable without regard to political affiliation and based on actual need, not a one size fits all approach. She argued that many residents continue to suffer from lack of food, building materials, and even basic mobility to access medical care, education, or supplies. You see, people are having life very hard and they really need help, and these people is like everything them politicize, everything them obviously they involve politics in which that is unfair. No, the next person you'll hear from is Dr. Alfred Dawes. Yes, you'll hear from him. But before you hear from him, I'm going to play a tape, if I can find it, about when you're talking about leptospirosis. Wait, and let me look up if I find it. And I have a piece of article here to read about it also. So just give me a chance to. This is Dr. Alfred Dawes. In this let me find it. Let me have the thing with the news about the leptospirosis. Hello? Abi, can you come to me, please? Oh, I may come. Give me a chance, people. One second. Come in, man. Come to the flashlight. Oh boy. I want to find the news on thank you for waiting guys. I want to find the news on have you sent me an article today about the leptospirosis thing? Can I phone someone again? Eh? Uh, minus the 57 on it. It's I know. Oh, you send on the all on the smooth phone, right? On the smooth phone, you send it. I think. Music on this. Oh, I really just please. What me can't find. I never plan on reading it about. Let me see if it is on this other phone. Yes, it's on this phone. It is. Um, Now leptospirosis spreading all over the place. All right. This is an article that I got today, and I'm going to read it. The official death toll from Hurricane Melissa remains at. No, this is not about leptospirosis. It's about the death toll. Anyway, I'm going to read this being as we start already. Remains at 45, with 16 persons still missing in its aftermath. Director General of the Office of Disaster Preparedness and Emergency Management, ODPEM, Commander Alvin Gale expressed condolences to affected families while he made this report at a special press briefing this morning. He, he, he reassured civilians that the Jamaica Constabulary Force (JCF) will continue to mount efforts to locate these missing persons, having already reunited 18 missing persons with their families on date. So you see, people are still missing. But the one with the leptospirosis, I wanted to find it to read it to you, but I can't find the video, and I'm going to find it tonight. I'm going to find it tonight. Thank you for joining. I'm looking for this bit of news I have here. I have so much different news on different phones. Just give me a second. Let me see if I can find it for you. I saw it this evening. Anyway, let me let you continue to listen what Doctor Dawes saying. Another day I will let you listen to one about the leptospirosis cases that rise in Jamaica. So let me make you listen to Dr. Dawes.
Have completely
Well,
crumbled.
this is
But it's so
Zulika.
bad because my
All right, can
10 million
just
dollar
listen from
daughter,
here. Dr.
and I
Dawes will
still
come
don't know how
after
we're going to
her.
help the rest of the residents in Windsor and the other areas in
Dr. Dawes will come
Embrace who
after
have
her
flooded
speech.
out and who go around and pick up two sheets of zinc and nail it on or tack it back on. But them know that the next shower of rain, they're going to wet up again and they're going to strong gust of wind, they're going to blow up again. But it's not plan. I close by saying that I have absolutely no intention to be cantankerous, and if I am being somewhat passionate, forgive me. But when you represent people who see you as their only hope, who come to you because they have nobody else to turn to, we have a duty to speak on their behalf. We have a duty to hope that the government listens and the government acts. Thank you.
You're going to hear from Dr. Dawes, no?
Thank you, Member Moderator. It will appear as if we're at the cusp of a health crisis. And what we have recognized is that there is a suboptimal response from the government in this regard. We're going to have our opposition spokesperson on health and wellness, Alfred, also in this matter. Thank you, Senator. The
Thank you
us
for
who have
joining,
spent their
everybody.
lives playing politics to stop playing politics with people's lives.
Right.
Today, I give you an update, having met with the technical team at the Ministry of Health, the Minister himself, and being on the ground, conducting missions, meeting with persons who are actively involved in trying to improve and assess the health situation in the most badly affected Western parishes. We must give what is due to Caesar. The Ministry of Health has, in fact, done quite a bit, as Dr. Campbell said earlier, in terms of being responsive to deploying some of the clinics and the restoration of services at some clinics and the improvement of the infrastructure of some hospitals, such as Cornwall Regional Hospital, having no other roof uh, replaced by Medicine Sans Frontiers or Doctors Without Borders. We, however, are very concerned about whether or not public health care is getting the attention it deserves. We have to understand that the crisis that is unfolding now out west, it is not merely the realm of the Ministry of Health and the technocrats, doctors, nurses, and vector control workers, public health inspectors. It is not under their control. What is happening is that it is a multidisciplinary, multifaceted approach that is needed to stave off the impending crisis. We are already in the midst of a leptospirosis outbreak, and we would have seen this coming. We ought to focus not only on trying to send out information to say avoid streets and water, avoid rodents, but we ought to look at how we can address the environmental factors that are causing this outbreak. Garbage collection is an issue that
Right.
is piling up not just out west but across the island. Even in my constituency, that was largely spared from the brunt of the hurricane. Water is an issue. We heard from the MPs that water is rising in some areas. There is a stench of dead animals, and you cannot simply say to people, avoid contaminated water when that is the only water that they have available. So we have to look at the cleanup, we have to look at the access, and it is this multimodal approach that we're going to have in tandem with the work of the Ministry of Health that is going to stave off a worsening of the leptospirosis outbreak, as well as try to mitigate, if not completely avoid, the threat of dengue and chikungunya.
Kaya hanggang natin ano, ano.
When we speak about leptospirosis being an issue, it is a disease that is largely mild, but when it gets bad, it gets bad, and it can lead to death because of liver failure, bleeding out, renal failure, and therefore early diagnosis and treatment is essential. Questioning the capacity of the Ministry of Health to adequately confirm cases of leptospirosis. Do we have the capacity locally to test for leptospirosis? What thoughts are being given to deploying rapid
Thank you for joining, everybody. Thank you.
because they do not have a generator, and therefore you have
Like,
to
share, and
be
subscribe as you come
concerned
in.
about
Thank
non-compliance as a result of these socio-economic factors that are now more than ever playing a role in healthcare. We have gotten some complaints about the process to facilitate missions. There seems to be a lack of coordination on the ground, even if persons are fully registered and they have been listed as partners. They still face some obstacles, whether or not the team on the ground were expecting them, and who are they partnering with to mobilize people in the community. In many instances, if the members of parliament are not a part of the mission initially, they do not have the wherewithal to rapidly get to know the persons and mobilize them to take advantage of the free medical services. So again, this is an echo of partnership and not just trying to have hegemony over the relief efforts. And this includes the medical missions. Now, when we speak about the way forward, because this is not going, the situation that exists on the ground is not going away anytime soon. There are too many people who are homeless, there are too many people who are marginally living on the fringes of survival. And as a result of that, the conditions that exist for leptospirosis to continue.
you. Let me give you the next piece.
That exist for leptospirosis to continue and for dengue and chickpea to have outbreaks here. We're only 90 miles away from Cuba, and they have more people with leptospirosis, with dengue and chickpea than there are people living in Jamaica, over 3 million. The conditions exist and they will in fact continue to exist for a while. So we have to plan accordingly. We cannot wait until we see a spike in cases and then we have a knee-jerk reaction. We must be able to anticipate that there will be an outbreak, there will be a spike, certain communities will be affected more likely than others. And we try to stave it off and put in mitigating measures. I don't believe in solely relying on power. Cuba is dealing with their own epidemics right now. They have best practices that, because of the relationship that we've had with Cuba for quite some time, they're willing to share with us. Let us call on the Cubans for help. They have a very good system where they look at the environmental factors. Is there a lot of garbage? Is there a lot of stagnant water? Is there increased rainfall in the area? All of which we know has been described as happening out west. You look at these environmental factors. You look at the behavior of the people. Are they bathing in the rivers? Are they using exposed to contaminated water? You look at their access. They have access to healthcare, access to public education, to resources. If they get sick, they can report in or go to a hospital. And of course, you have to look at the history of the area. There are some places in Westmoreland that have a history of typhoid. Now, when you factor in all of these determinants that contribute towards an outbreak, you engage community leaders, you launch public education campaigns, clean up the place, sanitize, ensure that you have adequate garbage collection, ensure that you have potable water, you treat breeding sites, you do fogging, get rid of the vectors, and then you may reach a point where you do not have a spike in cases. And that is real primary prevention. That is the basis of public health, which has been proven over 100 years now. So, in 200 years from the cholera epidemic in England, so we want to entreat those who are in charge of the disaster recovery to employ early warning systems for healthcare now. Not just surveillance to say that you have spikes, but predicting the likely locations of outbreaks and intervening. And to do that, you must combine environmental data, behavioral patterns, historical And you must also ramp up testing capabilities, confirmation testing, as well as introducing rapid testing. And with that, we can have early intervention, simple medicine that can save lives in the case of leptospirosis, or treatment of renal failure with fluids early out. Dengue, you can identify when it is becoming hemorrhagic fever or you're bleeding out and have early intervention as well.
I'm telling me
And
something
we
there,
must
brother.
have a mechanism where you have real-time reporting of fever. If you have a fever, there must be a way for you to report that you have it so that you can get tested. Vector control has to be augmented by private contractors, bringing it back the part-time workers. But the schedule for vector control cannot be such that uh, communities, such as mine in southeastern Catherine, basically have fogging once every 2 weeks at best, and we have 18 communities, and we are plagued with mosquitoes in one morning. So we have to ramp up vector control immediately, and because garbage pile up leads to rodent infestation, we have to ensure that garbage is being collected across the island in a timely manner. For communities where you cannot effectively solve the issue, especially with rising groundwater, evacuate the residents. Get them out of the conditions that are going to lead to respiratory infections, waterborne diseases, as well as those that are vector-borne.
Right.
And of course, you have to, and this is echoing the call of all my colleagues, do not try to do it alone. Engage both sides of the political divide, engage community-based organizations, the church, community leaders, get everybody on board to identify the most vulnerable,
Right.
pinpoint the areas where you have to have a heightened presence. And this is the only way we can have effective response. We may have to consider looking at the distribution of mosquito nets and repellents
Yeah.
to avoid
It will be good.
persons who are living outdoors and in shelters getting bitten by mosquitoes. And of course, the Ministry of Health has to anticipate that if all of these measures fail, what we're going to have a surge in patients coming into the hospitals. What is the surge plan in terms of bed capacity, in terms of staffing, testing, and treatment? We have to have a preparation, a plan in place for the worst case scenario. And then, of course, rehabilitation, especially when it comes to chickpea, is important for
Lord help,
long-term
Lord help us.
productivity and gain control. And in all of this, I left this for last. Mental health. People are numb now. They are not feeling and processing what is happening. You cannot have a psychologist or a mental health team going out and tell them better must come and then send them back to their tarpaulins to live. We must have coupled with mental health checks and interventions prove for the people that their conditions will be improved in very short order, and we're not forgetting about them when the new schemes have left and they are on their own and we're looking at this situation as a 9-day wonder. We must have interventions coupled with the psychological effects, psychiatrists getting involved. All of this must be complemented by improvement, tangible improvement in their lives, so you give the people hope. This is where I leave it. This is what is happening on the ground. This is what we must prepare for. And if we don't prepare for it,
Thank you for joining, guys. Thank you.
Have the expectations that we will pay for it in lives.
Yes. So now I'm going to play you now the recording. The news about the leptospirosis. But I sent it over where it is. Oh, wrong phone missing it on. Give me a second here.
That exist for leptospirosis
I'm looking for that.
and for dengue and chickpea to have outbreak outbreaks here. We're only 90 miles away from Cuba, and they have more people with leptospirosis, sorry, with dengue and chikungunya than there are people living in Jamaica, over 3 million. Um, the conditions exist and they will continue to exist for a while. So we have to plan accordingly. We cannot wait until we see a spike in
Find the
cases
news
and
woman on
then
the
we
last
have a
one.
knee-jerk reaction.
Send it
We
from
must
wrong
be able to
phone.
anticipate that there will be an outbreak, there will be a spike, certain communities will be affected more likely than others, and we try to stave it off and put in mitigating measures. I don't believe in solely relying on PAHO. Cuba is dealing with their own epidemics right now. They have best practices that, because of the relationship that we've had with Cuba for quite some time, they're willing to share with us. Let us call on the Cubans for help. They have a very good system where they look at the environmental factors. Is there a lot of garbage? Is there a lot of stagnant water? Is there increased rainfall in the area? All of which we know has been described as happening out west. You look at these environmental factors. You look at the behavior of the people. Are they bathing in the rivers? Are they using exposed to contaminated water? You look at their access. Do they have access to healthcare, access to public education, to resources? If they get sick, they can report in or go to a hospital. And of course, you have to look at the history of the area. There are some places in Westmoreland that have a history of typhoid. Now, when you factor in all of these determinants that contribute towards an outbreak, you go in, you engage community leaders, you launch public education campaigns, you clean up the place, sanitize, ensure that you have adequate garbage collection, ensure that you have potable water, you treat breeding sites, you do fogging, get rid of the vectors, and then you may reach a point where you do not have a spike in cases. And that is real primary prevention. That is the basis of public health, which has been proven to work over 100 years now. So maybe 200 years from the cholera epidemic in England. So we want to entreat those who are in charge of the disaster recovery to employ early warning systems for healthcare now. Not just surveillance to say that you have spikes, but predicting the likely locations of outbreaks and intervening. And to do that, you must combine environmental data, behavioral patterns, historical outbreaks, and you must also ramp up testing capabilities, information testing, as well as introduce rapid testing. And with that, we can have early intervention, simple penicillin that can save lives in the case of leptospirosis, or the treatment of renal failure with fluids early out. Dengue, you can identify when it is becoming hemorrhagic fever where you're bleeding out and have early intervention as well. And we must have a mechanism where you have real-time reporting of fever. If you have a fever, there must be a way for you to report that you have it so that you can get tested. Vector control has to be augmented by private contractors, bringing back the part-time workers, but the schedule for vector control cannot be such that communities, such as mine in southeastern Catherine, basically have fogging once every 2 weeks at best, and we have 18 communities, and we are plagued with mosquitoes in Portmore. So we have to ramp up vector control immediately, and because garbage pile-up leads to rodent infestation, we have to ensure that garbage is being collected across the island in a timely manner. For communities where you cannot effectively solve the issue, especially if there's rising groundwater, evacuate the residents. Get them out of the conditions that are going to lead to respiratory illnesses, waterborne diseases, as well as those that are vector-borne. And of course, you have to, and this is echoing the call of all my colleagues, do do not try to do it alone. Engage both sides of the political divide, engage community-based organizations, the church, community leaders, get everybody on board to identify the most vulnerable, to pinpoint the areas where you have to have a heightened presence. And this is the only way we can have effective response. We may have to consider looking at the distribution of mosquito nets and repellents to avoid persons who are living outdoors and in shelters getting bitten by mosquitoes. And of course, the Ministry of Health has to anticipate that if all of these measures fail, what we're going to have a surge in patients coming into the hospitals. What is the surge plan in terms of bed capacity, in terms of staffing, testing, and treatment? We have to have a preparation, a plan in place for the worst case scenario. And then, of course, rehabilitation, especially when it comes to GP, is important for long-term productivity and pain control. And in all of this, I left this for last. Mental health. People are numb now. They are not feeling and processing what is happening. You cannot have a psychologist or a mental health team going out and tell them better must come and then send them back to their tarpaulins to live. We must have coupled with mental health checks and interventions, hope for the people that their conditions will be improved in very short order, and we're not forgetting about them when the new schemes have left and they are on their own and we're looking at this situation as a 9-day wonder. We must have interventions coupled with the psychological effects, psychiatrists getting involved. All of this must be complemented by improvement, tangible improvement in their lives, so you give the people hope. This is where I leave it. This is what is happening on the ground. This is what we must prepare for. And if we don't prepare for it, we can have the expectations that we will pay for it in lives. Thank you. Thank you, MP.
Yes, man. I just love how they come out and speaking out. That's how it's supposed to be. I'm going to read the article that about what was up the briefing. I'm going to read the article. In that briefing, Dawes warned that Jamaica could pay with lives if the government does not mount a comprehensive response now to public health risk in the aftermath of Melissa. He said that a multidisciplinary a multidisciplinary, multifaceted approach is needed, not just public awareness messages urging people to avoid floodwaters or rodent-infested areas, but also meaningful action round cleanup, garbage collection, debris removal, and environmental um, um, remediations. Thus noted that the country is already in the midst of a rising outbreak of leptospirosis and faces the risk of other diseases, including vector-borne illnesses such as dengue fever and chikungunya (CHIKV) due to stagnant water, accumulated debris, and increased mosquito and rodent populations. He pressed concerns about the capacity of the Ministry of Health and Wellness to properly detect and confirm into affected areas, strengthening testing and surveillance capacity, and if conditions demand, evacuating residents from inundated zones that are high risk for disease outbreak. He also urged that efforts should not focus solely on relief food, water, shelter, but on long-term environmental and public health recovery. Cleaning debris, restoring water, no, cleaning debris, restoring waste, disposal of sanitation, and ensuring safe water access. So this is what is mentioned in his video out just now. Now I'm going to play a piece of video about the news mentioned the other day about leptospirosis,
Health
MOHN.
officials are moving with urgency as Jamaica confronts an outbreak of leptospirosis in the aftermath of Hurricane Melissa. 6 people have already died from the disease, but the health minister insists the situation is containable if the public acts swiftly.
Now listen this. The other day they said it was 6 people, right? But on another news, I think it was today or yesterday, I heard it's 12 people now. And that's this news that you are listening to is from last week. So it is increasing.
In the wake of Hurricane Melissa's devastation, flooded communities, overflowing drains, and rodent infested debris have triggered a threat. Silent but deadly leptospirosis. Health Minister Dr. Christopher Tofton says his ministry is confident the outbreak can be brought under control in short order.
Firstly, the hospital system is very prepared to deal with both testing and treatment. This is a bacteria that can be treated with early notification. Antibiotics does that. We are fully equipped. Secondly, though, the prevention side, we have deployed a number of both health workers in communities that have been flooded out and where stagnant water and contaminated water, which is the main carrier coming from the rodents or dead carcasses, where that poses a risk. Our team are out in the field in those communities.
He says teams have been deployed to conduct water treatment in affected communities to ensure residents have access to safe drinking water. Public health workers are also sensitizing residents about proper food storage and the importance of wearing protective gear during cleanup activities. The ministry confirmed the outbreak last week after the bacteria-driven disease claimed 6 lives. Since then, 9 cases have been confirmed and more than 20 suspected or probable infections are being monitored closely. Leptospirosis spreads mainly through water contaminated with animal urine, especially from rodents. Public health teams say many communities, particularly in rural parishes, remain vulnerable as residents continue to wade through stagnant water, clean up debris, and salvage what they can from damaged homes. If left unchecked, doctors warn the disease can escalate quickly. Initial symptoms mimic the flu, fever, muscle pain, and vomiting, but severe cases can lead to kidney failure, liver damage, internal bleeding, or even death. That's why the health ministry has activated what Dr. Tufton describes as a multi-agency response.
We're working with national agencies around cleanup, the National Solid Waste Agency, which is responsible for moving solid waste. A lot of that is taking place in the targeted communities. And we're working with the Ministry of Labour and Welfare in terms of support to citizens who have lost personal possessions and who are in the process right now of cleaning up. So it's a multi-agency, multi-ministry approach.
Dr. Tufton is urging Jamaicans to seek medical help at the first sign of illness. Health officials are moving with urgency.
So, so, um, so that's it, guys, for tonight. I'm gonna end right here. So you see, those are out there. Be careful of the dirty water. Be careful. Keep safe. Try your best to drink clean water. Avoid the stagnant waters, and just be careful because things is rough out there right now. So thank you guys for listening. Thank you, thank you, thank you. Take care and God bless. Bye now. Bye.